The Immunization Policy by Wendy Medina. Around 2 to 3 million people are prevented from death by getting prevented by diseases while having an immunization. I got this information from the WHO 2019. How many of us have thought to ourselves about how often we get the flu? Not much, because we are usually pretty healthy, and if we get the shot, then the possibility of us getting the flu or any other type of disease is most likely low. And we usually do feel fine within a week if we do get sick. I have been getting my necessary vaccinations since I was born, and I keep following up because I need to have physicals for when I was in school, but I also keep up with them now in order to keep myself safe. I think that the immunization policy should be supported, and today I will inform you about the history of the policy, the problems, the solutions, the practicalities, and the actions towards the policy. For my main point about the history of the immunization policy, the APA was formed in 1938. It was called the Red Book. That was really just 8 pages that informed the prevention of diseases in adults and children's. And I got this information from an article in Science Direct 2015. The immunization policy was amended in 1964 under the ACIP, which informed and advised on the safest and most effective ways to apply the immunizations in children and adults for the communicable diseases. I got this information from Science Direct 2015 as well. And the 6 roles of the government regarding immunization is to improve coverage and surveillance of the vaccine to make sure that it is effective. And we also are getting coverage and it is safe. And we're also trying to sustain and improve how the immunizations are covered, because not everyone is able to afford Medicare. And we need to prevent the spread of the diseases. I got this from an article in the Institute of Medicine in 2002. And the rules state that the states can make their own policies regarding the immunization policy, and there has to be free clinics, and public schools must have documents regarding the immunizations that the kids have had. And so now that we have looked at the history and rules of the policy, we can turn our attention to the problems. So the first problem that there is that although public schools do mandate immunizations, there are some parents who don't feel like their kids should get immunizations because they feel that they will get sick and they don't want that for their children. And they can get out of this by having a doctor's note. And I got this information from Science Direct 2008. Also, adults are not encouraged to get the immunizations. It's basically up to them if they want to and when they go, because they're not being mandated by a school to get their immunizations. And I got this information from an article in Science Direct 2018. Also, another problem that the immunization policy has is that it can be a financial burden on people who don't have enough money to cover the costs of the immunizations, whether they don't have insurance or they just have low income. And I got this from the Institute of Medicine in 2000. So now that we have looked at the problems, we can turn to the solutions. And the solutions, the first one that we have is that people should be mandated to get immunizations, especially children, unless it is a life or death situation, because it not only is protecting the kids' safety, but also the kids around them who might be immunized, but they could still get sick, whether they have a low immune system or are okay, but they can still get sick, especially kids with low immune systems who might not be able to get the immunization for health reasons and not just because their parent does not want them to get it. Also, adults should be encouraged. I got this information from an article in Healthline 2019. And adults also should be encouraged and mandated, because if they're not getting mandated, then they're not going to follow up with their regular doctor visits, and they are just going to keep living their life without going to the doctor and making sure that they are keeping themselves safe and the ones around them. I got this information from the CDC in 2019. And also, another solution to the immunization policy is that the immunizations should be low cost or be available without insurance, so that everyone can be safe and they are accessible. And then I got this information from vaccines.gov 2020. Now that we have looked at the solutions to the policy, we can turn our attention to the practicalities of the immunization policy. So although all these solutions are not all perfect or can be perfectly sought out, they can be improved. Nowadays, children are getting unvaccinated because the parents feel that it is unethical and they shouldn't be forced to vaccinate their children. So, for example, there was a kid who went to school his whole 18 years of his school career. He wasn't vaccinated, and all his other friends were. But when he turned 18, he got all of his necessary vaccinations in order to be protected and protect the ones around him. And this should not be left up to the parent, even if they are underage. It should be for the safety of the children. And I got this information from Undark in an article in Undark in 2019. Also, in order to live a healthy life, we need immunization policies to be fixed for everyone, and because it shouldn't be a luxury for only a select group of people to have. It should be readily accessible to everyone, and it should be low cost or free. Now that we have looked at the practicalities of the policy, we can look at the action, the call to action. So the AVAC is the Adult Vaccine Access Coalition, and they aim to improve the rates of immunizations for adults, since they are not regularly going to get their immunizations, and just not for children, because also adults also need them as well. And I got this from the site of the AVAC. By becoming a member, you are trying to improve the rates of adults who are getting vaccinated, and we are trying to reach that goal of having more people be vaccinated. And in order to join, you just go onto their site and you look at a button that says contact us, and when you submit your name, your email, and the organization, you can also insert a message if you'd like. So in conclusion, the immunization policy should be supported since it is doing good, but it can be improved. Millions of people are affected by the immunization policy, and it is important to have everyone be safe and have immunizations in order to protect themselves and the ones around them. Each year, people die from not having immunizations or still getting sick, and it is better to lower the rates. So especially now in the in the era of COVID-19, we want to we want to find an immunization for COVID-19 and lower the death rate. So thank you. That is all.